When the coronavirus first arrived to America, there were only a few symptoms that everyone knew to look out for: fever, cough, and shortness of breath. However, as scientists and physicians have become more familiar with this novel virus, they quickly realized that these symptoms are not the only ways patients are showing signs of COVID-19. In fact, while COVID-19 was originally thought of as a respiratory disease, physicians are now seeing signs that it could also be an inflammatory disease that affects multiple systems of the body. While you don't have to know how the disease works in order to protect yourselves and your patients, you should be familiar with potential symptoms or warning signs that come with COVID-19. Symptoms of COVID-19 can appear anytime between 2 and 14 days of exposure to the virus. Symptoms can appear gradually and may not appear at all if someone is asymptomatic. Symptoms can vary in intensity from person to person. The Centers for Disease Control and Prevention now include these symptoms. Fever. This can be a low-grade fever under 100 degrees or a high fever above 100. Cough. Perhaps the most common COVID-19 symptom. The cough is typically dry. Shortness of breath. If your patient is experiencing shortness of breath, it's time to consult a medical professional quickly. You can tell if your patient has shortness of breath if they're gasping for air or struggling to take deep breaths while resting, after light activity like getting off the couch, or even while talking. Fatigue. Feeling exhausted or tired all the time can point to fatigue. Muscle or body aches. These aches and pains can range from mild to severe and often accompany feelings of fatigue, loss of taste or smell. This odd symptom is more and more common among COVID-19 patients and can lead to decreased appetite or weight loss. Headache. Different from general body aches and pains, a headache from COVID-19 can range in severity from mild to moderate. Sore throat. Congestion. Even though coughing with COVID-19 is mostly dry, the patient can still feel and sound congested. Runny nose. Nausea, vomiting, or diarrhea. It can be difficult to determine if symptoms are from COVID-19 or the common cold or even seasonal allergies. A coronavirus test can determine if symptoms are being caused by the virus. If you or your patient has signs of COVID-19 like fever, cough, fatigue, or shortness of breath, contact your agency immediately.